Okay, coming back to the topic. Sorry, there was some disturbance in the internet. That's why we were not in class. Okay, so we discussed that this is the excuse me. This is the basic classification of your parasites. और ये जो picture है ये आपकी ही book है बेटा table. ये आपको आनी चाहिए. This is the basic classification. And whenever they are asking about parasites, they definitely ask about the classification of parasites. So after anatomy based analytica, which we done yesterday with Dr. Rubina, today we will discuss Giardia lamblia. And what it is basically it's a protozoa which causes giardiasis. The important properties of its life cycle are that there are two stages. One is trophozoon and the other one is trophocytes, and the other one is the cyst form. If you can see the slide, this is the cyst form. This one. It's inverted pear-shaped cyst, and this is the trophocyte. And from there, this is again further divided. These are the certain parts of its body. It has flagella, so it is a mobile kind of parasite protozoa. The trophocyte is pear-shaped with two nuclei and the four pairs of flagella. These are the two nuclei, and these green are the four pair of flagella. And a suction disc which is attaches to the intestinal wall. This is the suction disc, this purple one. So from this thing, it gets attached to your gut inside the intestines, basically. Yeah, this is from your book, and it comes like this, same. And it's an important feature and easily recognizable in the OSPI section. The oval cyst is thick-walled and with four nuclei and several internal fibers. Each cyst can rise to two trophocytes during the egg gestation in the intestinal tract. This is the cyst, and it has four nuclei, and when they get divided, each cyst will divide into two trophozoites, and they will have two pair of each pair of nuclei. Transmission occurs by ingestion of the cyst in fecally contaminated food and water. Excitation takes place in the duodenum, and with the trophozoites attached to the gut wall, but does not invade. The trophozoites cause inflammation of the duodenal mucosa, leading to the malabsorption of the protein and fat. I hope it is clear. It's not difficult. Most of the parasites are transmitted through fecal route because the gut is involved. And then the division is usually in the intestines, and then later on they make the mucosa of the present form of gut. Like in this case, it's duodenal mucosa, and the inflammation is there, and it will cause harm to your malabsorption to the protein and fats of your body. Approximately half of those infected are asymptomatic carrier, which continue to excrete the cysts for years. So the carrier state is very important in this. And in the carrier state, patient is asymptomatic. As I told you before, in many bacterial diseases, that the patient are carrier, but they don't show any kind of sign or symptom. So they excrete cyst for years, and if that excreted cyst is getting into the contact of any other person through water or your food, that will result in the infection spread. IgA deficiency greatly predisposes to the symptomatic infection. If you see, this is the life cycle of Giardia. There is some ingestion of the contaminated food or water, and then it's going, yes. And then there is excitation of the trophocytes which will get in the food. Actually, it is the other way around. From contaminated food, the cysts get into your body, and these cysts get mature into cysts, the trophocytes, and the trophocytes become further divided into excistations, and then they are related to the trophocytes, which again get into the other's body through contamination. This is the parasitic stage is trophocyte, while the cystic stage is human in the in the humans, or the life cycle is happened at a small intestine, then it can be in humans as well as in the rodents, dogs, cattle, or pig or sheep. Infective stage is mature coordinate nuclear cyst, and then root of the infection is fecal root or autoinfection. Autoinfection in the case that if you are releasing cyst into the feces, and that is again getting into yourself again and again by your contaminated hands and poor hygiene state. The diagnostic stage is cyst or trophozoite, depending upon if either it is auto-infection or the transmission to the other person. Clinical finding is that there is watery diarrhea, there will be no blood. Like in the maybe the dysentery, there is a bloody diarrhea. While in the Giardia, it's a watery diarrhea. Foul smelling diarrhea is accompanied by nausea, vomiting, anorexia, fluctuance, and the abdominal cramps are usually present for weeks or months. There's no fever in this because it's a benign kind of GAT disturbance. How you will diagnose a case of Giardia? It's direct microscopy. Diagnosis is made by the finding of trophozoites or cysts in the diarrheal stool. Informed stools may be present, the cyst only may be present in the asymptomatic patients. And serological testing, if you go for the ELISA testing of direct Giardia, cyst wall antigen will be present in the stool, is also very useful. If you are unable to see any of these two types of the Giardia in the direct microscope. There's a string test which is done, and for this test, you swallow a gelatin capsule attached to the long string, and the end of the string remains outside the mouth. So it's like a tape to your, it's like a tape, and you then put the tape, another artificial tape on the cheek, so that the tongue will be there. And once the string passes into the upper part of the intestine, that is the duodenum, the string is left for 4 to 6 hours or overnight, and then it is withdrawn. And at the end of examination, the microscope of the parasites that are attached to that capsule, and it will show you either the cyst or the trophozoite. Or as a treatment, it's metronidazole flagyl, and as you all know, we all take flagyl for the gut inflammation and infection, and the quinine hydrochloride might be useful as well. How we can prevent? We can prevent all of these parasites by involving boiled water, by filtering the water, or by iodized water. And then we are taking care of good hygiene care, like with the main manners of toilet using, washing hands after every time you go to the washroom. Because these things are very important. And the contaminated food and water should be avoided. Next organism is also the same protozoa which are involved in the gut, that is Cryptosporidium. Cryptosporidium parvum called cryptosporidiosis. The main system in which is diarrhea. The diarrhea is most severe, but it is immunocompromised. Like I told you before, in many other diseases of the bacteriology, these are the parasites which don't occur in the normal patients usually. They are normal humans. They are usually more. They are more severe in the immunocompromised, and usually they involve mostly the immunocompromised patients like AIDS or all the other types which I told you before. So if you see, this is an interesting slide. It will show you the cysts of different types. This is the antiamoeba cyst. This is Giardia. This is Cryptosporidium cyst. You see all the 4 nuclei are together, and they recede fast lipids. Then this is the Saccharomyces. This is the cyst of oocyst of Toxoplasma. This is also the sporadic oocyst of Toxoplasma. This is Toxoplasma tissue cyst, and this is anthramoebic cyst. All right, but the pathogenesis, coming back to the Cryptosporidium, is the organism is acquired by the fecal route. As I told you before, all the gut parasites are transmitted through the fecal route, through contaminated water or contaminated food. And this is transmitted from one person to another or the animal source. The oocysts exist in the small intestine, where the trophozoites attach to the gut wall. The invasion does not occur. So it is just remind to the or the superior superficial layer of the gut wall. There's no invasion. Only the epithelial part is involved. If you see this one, this is a contaminated water containing the cyst, and then it is ingested by the humans. in the gut through again it is secreted in the feces of the patient, and then again the contaminated water is there. What are the clinical findings? They are basically, this is a disease of immunocompromised patients, and a watery non-bloody diarrhea causes large fluid loss, and symptoms persist for long period in immunocompromised patients where they are self-limited in the immunocompromised patient, competent patients. Although immunocompromised patients usually do not die of cryptosporidiosis, but the fluid loss and nutrition can severely debilitate the health of this immunocompromised patient. I hope it is clear that it will not harm any further in the immunocompetent or the normal individuals, but it will definitely cause severe malnutrition and fluid loss in the immunocompromised patients. How you will diagnose the case? It will be diagnosed by finding the oocyst in the fecal smears, and nothing else is done for this. Treatment and prevention, there is no effective drug therapy for the immunocompromised patients, but paramycin may be useful in the reducing the diarrhea. And nitazoxanide is applied for the treatment of diarrhea caused by this bug, and in children are 1 to 11 years of age. The third one is the Trichomonas. We will discuss this one and we will summarize all of these. Trichomonas vaginalis causes trichomoniasis. Trichomonas vaginalis is also a pear-shaped organism with a central nucleus. Now, how you will differentiate it from the previous one which we have discussed is that it has two nuclei, while it is a single nucleated, while the previous one having two nuclei. But the pear shape is there, and the flagella is also there. It has an undulating membrane that extends about 2/3 of its length, and it exists only as a trophozoite. There is no cyst, like this one. So it's also pear-shaped, but it has multiple flagella and one nuclei, and some undulating cyst inside. Normal habitat is vagina in females and the prostate gland in the males. It is transmitted to the sexual contact because it causes the infection of female genital tract. So normally it resides there, and it is transmitted through the sexual contact. In the women, what are the clinical findings? In the women, a watery, foul-smelling diarrhea, which is greenish in color, accompanied by the itching and burning occurs. Infection in men usually asymptomatic because it usually infects the urethra as well as and it is normal hepatitis prostate in males. And about 10% of the infected patients have urethritis. Otherwise, it's asymptomatic. How we will diagnose this case? In a wet mount, vaginal or prostatic secretions, and the pear-shaped trophozoites have a jerky movement, and there is no serological finding. How we will treat? The drug of the choice is metronidazole, flagyl for the both partners to prevent reinfection, and the maintenance of the low pH of the vagina is helpful. This was all about today, but we will now, as I was really fast, so we will revise or summarize all three of them. Okay, I just want to ask if you are all there. So, which one of the three parasites which we discussed today have 4 nuclei? Kindly name that parasite.
It's Giardia.
Yeah?
It's Giardia.
Amna, yes, it's Giardia. And as I told you that these 3 organisms, 2 are transmitted through the fecal route, while the third one is through the sexual contact. So which one are those which are from the fecal route? Anyone?
So it's Giardia lamblia, and Trichomonas is transmitted through sexual contact.
Yeah. Yes, you're right. And the third one? Cryptosporidium.
Yes,
I think only Amna was listening to me. Visma, where are you? I expect answer from you as well, and the way is Zanab. And from boys, all are sleeping, I guess, or just woke up. Hello, anyone?
Yes, ma'am.
So, Aika, what is the third one which we discussed today? फैजान साहब क्या कर रहे हैं? No answer.
Yes, ma'am.
हाँ जी बेटा जी actually due to certain shift of your face-to-face classes into online classes हमें module change करना पड़ा because I thought immunology is more difficult and conceptual. So उसके लिए आपको face-to-face करना ज़्यादा अच्छा भी था आपके लिए और ज़रूरी तो that's why we switched to parasites. I know कि it's a surprise for you but still first day से अगर आप एक एक parasite करेंगे साथ साथ तो आपके लिए फ़ायदा होगा. अब आज की डेट में आपके लिए ये चारों जो आपके टिश्यू प्रोटोजोआज हैं ये जो प्रोटोजोआज हैं गट प्रोटोजोआज ये आपके हो जाने चाहिए along with the trichomonas which is a vagina or prostatic parasite. So if you are having any kind of difficulty, if you don't want to discuss it now, just go and read the topic and then ask in our class group in the WhatsApp. So we will answer you accordingly. लेकिन इन सारों के जितने भी हम पैरासिटोजोइड्स करेंगे इनके साइकिल्स आपने उसी दिन रिवाइज करना है कि ये किस तरह से स्प्रेड होता है और क्या किस कौन सी इसकी इनसाइड ह्यूमन पार्ट ऑफ द साइकिल है और कौन सा आउटसाइड ऑफ द ह्यूमन सो यू शुड नो ईच एंड एवरीथिंग अबाउट दैट मेन क्लिनिकल फाइंडिंग्स इनकी क्या है एंड हाउ यू विल डायग्नोज द केस ये तीन चार चीजें ही हैं लाइक सेम लाइक द बैक्टीरियोलॉजी बट यू विल ऐड अ लाइफ साइकिल इनटू इट तो अपने लाइफ साइकिल जो बेसिकली पैथोजेनेसिस है वो दैट इज अ पार्ट ऑफ द साइकिल ऑफ द लाइफ साइकिल ऑफ द पैरासाइट तो बस मेनली आपने यही चीजें करनी है द सेम वे वी आर डूइंग द बैक्टीरियोलॉजी बट यू विल ऐड द लाइफ साइकिल इनटू योर बुक आपकी बुक में इट्स नॉट गिवन इन एज अ पिक्टोरियल पिक्चर बट इट इज डिस्क्रिप्टिव पैटर्न इन योर बुक सो आप उसके अंदर अगर ये ऐड कर लेंगे लाइफ साइकिल्स इट विल बी वेरी हेल्पफुल आई विल शेयर the life cycles in your group as well. आप उसको सेव कर सकते हैं या उसको ड्रॉ करके अपने पास रख सकते हैं. The life cycle is usually asked in the exams as well. आपके टेस्ट में भी पूछा जाता है, आपके क्या कहते हैं उसे स्टैंड अप में भी पूछा जाएगा, टर्म्स में भी एंड प्रॉफ में भी एक आध पैरासाइट जरूर साइकिल पूछा जाता है. So you should know कि कैसे लाइफ साइकिल ड्रॉ करना है. It should not be an artist picture कि बिल्कुल परफेक्ट आप ड्रॉ करें ह्यूमन भी और पैरासाइट भी और जो एनवायरनमेंट है वो भी बट इट विल समराइज द मेन कॉन्सेप्ट ऑफ द साइकिल कि एनिमल कैसे जो पैरासाइट है वो कैसे एंटर हो रहा है आपके अंदर ह्यूमंस के अंदर और अगर उसका कोई एनिमल साइकिल भी पार्ट भी है उस साइकिल का तो यू शुड नो कि विच एनिमल इज देयर आइदर इज कैट और डॉग और एनी कैटल फील्ड एनिमल तो आप उसके अंदर वो बताएं कि जी इनसाइड द काउ उसके अंदर क्या हो रहा है इनसाइड द मॉस्किटोज का क्या साइकिल होगा और इनसाइड द ह्यूमंस क्या साइकिल होगा सो ये चीजें इंपॉर्टेंट है इन पैरासाइटोलॉजी अदरवाइज आपको जो क्लिनिकल फीचर्स है वो भी ऑटोमेटिकली आपको समझ आ जाएंगे जब साइकिल आपको समझ आ जाएगा कि कहाँ से कहाँ बैक्टीरिया वो जो सॉरी पैरासाइट है वो जा रहा है एंड देन हाउ इट इज अफेक्टिंग द बॉडी ऑफ ह्यूमन तो उससे रिलेटेड जो भी सिम्टम्स आएंगे आई होप इट्स क्लियर आई नो इट्स न्यू फॉर यू इट विल टेक टाइम to get used to it but you have to make yourself organize according to the parasitology so that you can cover all of this accordingly because जिस तरह से हमारी पैटर्न चल रहा है your exams will be inshallah on the same date which is given by the UHS so your term and your every other task will be on the same as it is scheduled so please take care of the parasitology with the teachers so that अब तक आपको एंटीबैक्टीरिया आना चाहिए कल तक. Can anyone tell me what are the basic differences between amoebic dysentery and bacillary dysentery? पहले तो मुझे बताओ कि what is the difference between dysentery and diarrhea? जी, anyone?
So diarrhea is basically a loose stools, whereas dysentery is diarrhea with blood and mucus in the stools.
Very good. So this is the basic difference we should know. There are some other more points in it. I will inshallah share with you. What is the second part of it? What is the difference between a bacillary dysentery and amoebic dysentery? After yesterday's lecture, you should know by this. There is surgery on the same topic, and then Dr. Zara will explain you everything. In my next lecture, I will ask you what is the difference between amoebic dysentery and the bacillary dysentery. Amoebic dysentery is basically the dysentery which is caused by Ant-amoeba histolytica, and the bacillary dysentery is basically caused by the bacteria. And what are the bacteria which called this dysentery?
Shigella,
Shigella. And one more.
Campylobacter.
One more. No, Campylobacter.
Salmonella. Campylobacter.
No.
No.
Very rare cases, but it's not a common presentation of the Salmonella. Basically, it causes enteric fever. The enterohemorrhagic part of E. coli. Did you get that?
Yes, ma'am.
Yeah.
Yes, ma'am.
So that variant of the E. coli causes the bacillary dysentery as well. So you should know all these things up to now. आपको बैक्टीरियोलॉजी सारी समराइज करनी आनी चाहिए. आपके पास लिस्ट होनी चाहिए कि कौन से बैक्टीरिया हैं जो नॉर्मल डायरिया करते हैं, कौन से बैक्टीरिया हैं जो डिसेंट्री करते हैं, कौन से बैक्टीरिया हैं जो फीवर्स करते हैं, जैसे टाइफाइड फीवर हो गया, टाइफस फीवर हो गया. यू जस्ट हैव टू इलनेस देम विद यू. इसका क्या फायदा होगा कि आप जब भी कोई क्वेश्चन अटेम्प्ट करेंगे, यू मस्ट नो कि अगर ये पूछा गया है, इफ दे आर आस्किंग द डायरिया, तो ये ऑप्शंस हो सकते हैं फॉर एमसीक्यूज एज वेल एज फॉर द एससीक्यूज. And if they are asking you about the dysentery और वो bacillary dysentery, तो you should know, have a list कि कौन कौन से organisms है जो कि ये कर सकते हैं. So it will be good if you get it done by side. Like if you are done with the bacteriology, आपकी list तैयार होनी चाहिए. कौन से meningitis करते हैं, कौन से UTI करते हैं, कौन से diarrhea करते हैं, कौन से dysentery करते हैं, इस तरह की चीज. And then now we are moving to the parasitology, तो अभी से list बना लो कि कौन से अब क्योंकि हम घट के कर रहे हैं, तो दीज आर द वन. अब जो सेक्शुअल ट्रांसमिटेड की एक आ गया ट्राइकोमोनास, उसकी लिस्ट बना लो, उस पर ऐड कर दो. जब हम आगे जाएंगे देन यू कैन ऐड फर्दर इन डिटेल्स इन दीज लिस्ट. सो ये सारी चीज़ें बहुत हेल्पफुल होती हैं एट द एंड, जब आपको वो वाला टॉपिक समराइज करना हो. मीन्स के बैक्टीरियोलॉजी समराइज करनी है या पैरासाइटोलॉजी समराइज करनी है. सो ऑल दीज थिंग्स आर वेरी वेरी इंपॉर्टेंट. I think it's okay. Just you go, you still have 20 minutes for the lecture. Just go through your book and go through these three topics so that अभी भी हमने पढ़ा है तो आपको जब आप book read करोगे, it will become more clarified to you. अगर कोई चीज़ confusion भी है, if you want to ask any other question, I'm here. Otherwise, I will leave you to read from your book, and then we will discuss it later in the next class before starting the new organism. Is it okay with you, or you want to ask any more question? Any of you? Anyone?
No, ma'am.
And please make sure अगली दफा आप लोग तैयार श्यार होके आएं, because I want you all to open your cameras. I want to see, I want that interaction. That will be more easier for me to teach you better. Because इस तरह से मुझे लगता है आप सब लोग सो रहे हैं and I'm just reading a newspaper or some news to you. So it's better if you get your cameras on from the next lecture. I hope it is not a hurdle for you. Okay, so तैयार श्यार होके आना. Okay, take care and revise your lecture now from your book till your next class. And this is break, I think, from 10:30 to 11 for you. So just in next 15-20 minutes, go ahead and read it from your book. And then we will discuss it again before starting the next lecture next time. Take care. Allah Hafiz. Hello. Walaikum Assalam. ठीक है.